Hi, everyone. Thank you for the nice introduction, Jennifer. This is Akiko. I'm a GBB subsector coordinator for Sudan. I've been in this position for 3 years, so I've experienced three different contexts, starting from, transitional period after the coup, and then unfortunately it's worse, it's been worsening, it's a war. So I'd like to start my presentation. First, I recently visited, Chad, refugee camps, for Darfur, refugees who came from the Darfur, and also northern states and river Nile states. So I would like to share some stories of what happened after 11 months, almost a year of conflict. What is happening to women and girls, what they are experiencing, the life experience from the field. Next slide, please. Yes, so I'd like to highlight two really key points on the situation. One is because of the protracted crisis, multiple displacement, and also the subsequent life-threatening impacts. They are turning to innovative coping mechanism, and there are really significant in health impacts that they are experiencing, not physical but mental as well. So, as you may know, in mid-December, just, when, we were, about to, we were expecting, the situation to improve, at the end of the year 2023, we experienced the additional clash, and there is, additional 1.5 million IDPs who are, who are displaced, from Jazeera state to different parts of the, other country. So this really put a lot of stress, on, IDPs. And I was at the bordering area, northern states, Old Halfa. There are a lot of, there are increasing number of deportees. We don't call them returnees. They are deportees because they are actually deported from Egypt, whether by, be it because of, expired visa, or sometimes they did commit crimes and they were deported by Egypt. So these this group, the new group of population is joining in an IDP camps and deported camps in the northern part of the country. So they are all experiencing significant mental health issues. This of course contribute to the increase the life-threatening risks. Of course, it directly relates to increase of intimate partner violence. And also, we've heard a lot of stories of, attempted suicides and suicidal tendencies. We've been hearing this for a long time, but, what I hear from the field that this is, even increasing. This is, continuously increasing among IDPs. And because it's been 11 months since the war started, those of the survivors who experienced the GBB at the beginning of the war, yeah, and they were unfortunately unable to access to clinical management of rape in a timely manner. They got pregnant, and because of this unwanted pregnancy, what happens is that when they go to deliver at health facilities, their babies cannot get birth certificate. They only get birth notification, so they are not really recognized as a citizen. So in order to get a birth certificate for the children, this survivor needs to go to court and prove that she's been raped, and then they will be the babies will be given a birth certificate. So it's an extra layer burden, and also it's extremely challenging to prove that someone who was in the conflict affected states accessing justice system in IDP hosting states such as River Nile state and northern states, then give enough evidence and prove that they have actually been raped. So this will result in increased abandoned children abandonment. And also even if they decided to keep the children and babies, they will be isolated from the community. So this is increasing becoming a significant programs after almost a year. And another shocking story I heard is that the FGM is the is, worse than we thought. So what I heard from, health, care providers is that, there are, quite a number of women who came from, conflict affected states, they were raped, but they still want to get married. So they are requesting, or their family is requesting for, to perform FGM. And also, some parents, the family members of, girl child, they are, they believe that, FGM can, serve as prevention, of sexual violence. So they will, force, their girls, daughters to undergo FGM. Then, in order to, prevent them, being raped, they will marry them off. Also, it also, comes from economic hardships as well. So these kind of life-threatening impacts are, increasing. Next slide, please. Okay, and also, increased vulnerability. So the risk that I've seen in, GBB, on GBB and in the sexual exploitation abuse risks was really, more significant than I imagined. So there is a massive shortage of latrine. The latrine as you see on the left top is actually, it's not in Sudan, but this is a latrine I saw in front of Women's Center in Adre, transition camp in Chad. This cannot be called a latrine. I think this is the worst latrine I've ever seen. In the camps in northern states and, and the River Nile states, I've seen that, sometimes camps have, 2 female latrines against the 1,650 IDPs, who are in the camps. They are, exploited even using latrines. They are, people waiting at the latrines, trying to, make women pay for the latrines. If they don't have, money to pay, they ask for sexual favors to use latrines. So they are really, facing massive, SEL risks, just seeking for basic services. And also because of the increased number of IDPs, just to get basic commodities, basic, food, fuels, water, they have to travel longer distance compared to before. This will also expose them to the risks of, GBB as well. The right top, you see the, small container and beans. So this is, food distributed for 4 family members, in a camp in Shendi, in River Nile states. So they have to survive with this portion of food, for the whole day for 4 people. And, second from right top, second from the right, there is a, tent, picture inside the tent, says IOM. So this tent is, 1 meter times, 2 meters. It's a very small space. There are 4 family members, living in this space. It's extremely overcrowded, no privacy, no door. So you can imagine the heightened risk that, they are, facing. And what I would like to also emphasize is this, Shaza is going to also talk about it, is that, they have very strong, fear of being stigmatized and also fear of being expelled from IDP camps or host communities. So when authorities around, when people who are supporting, them, host communities is around, women and girls don't talk about their experience. They are extremely afraid of losing place to live. So, we really, I would really like to emphasize that localization is life-saving. Creating, safe spaces for women and girls, free to speak and, safe space to speak up is a life-saving in this kind of context. Next slide, please. Yep. So I would like to just to give a, subsector, DB subsector 2023 achievement. We had 4 million people in need, 1.3 targeted, and we've reached 105,000 women reached. Sorry, 221,000, beneficiaries reached, including almost half of them women. Now, I would like to really highlight that, 66%, are reached by local NGOs. And, of total, 42% are reached by women-led organizations. As you can see a lot of blue color, in, conflict-affected states. And this is these are the actually showing the severities. But if you look at the response monitoring, we do have response happening in Darfur states, Khartoum states, the severely affected states, conflict affected states. This really shows the importance of localization again in this context. Next slide, please. Yeah. So I'd also like to show the 2024 plan overview. Now, please note that this was finalized before the clash in Medani. So this is only reflecting what we were planning before the clash in Medani. So the figure will be, higher. We were in process of recalculating it, but, it's like going to be higher. Now, the people in need has increased from 4 million to 6.7 million. This is non-refugees only. Financial requirement is 63, but as you can see, ping is, increasing in all states, particularly in IDP hosting states in northern and the River Nile states. And Darfur states, ping was already high, but it has even increased after, the calculation planning for 2024. Next slide, please. Yes, 2024 achievements. So we've only, compiled the result, as of end February. But as of end February, we have a 16.1 funding received against our funding needs, which is 63 million. Please note that this is very modest estimate because we are asked by OCHA to target realistically. So this is very modest, but even with that 60.1% has been achieved. We have reached 13,045 people reached, but again, 49% reached by local NGOs and women-led organizations. So this is really shows the importance of reaching in hard-to-reach area. You can see the blue in the Darfur states and Khartoum states as well. So I would really like to emphasize that really to continue investing on women-led organization and local NGOs. And Shaza is also going to talk about what is the most effective investment in terms of investment to women-led organization. Next slide, please. Yes. So here I would like to introduce a result from the GBB capacity assessment that's conducted by Sudan GBB subsector information management team in January 2024. So what I would really like to highlight here is that as you can see the lines here and there, these states that are affected by the conflict, organizations themselves are displaced from Jazeera to Port Sudan, Gadaref, White Nile, Damazin, Kasala, Central Darfur, to West Jebel Mara, White Nile. So they are displaced and they still need to operate. So this really shows that, we really need to take a consideration to support their operational capacity, because some of them really lost everything and re-establishing themselves in the new states. And some of them, experience multiple displacement, losing their staff. Sometimes, their staff were killed, but they are still delivering on the ground, particularly local organization, women-led organization. Next slide, please. So we also, the same survey, GBB capacity assessment survey, which was conducted, for partners who are present in 16 states out of 18 states in Sudan. So, the biggest barrier, as you can imagine, is communication, internet. So, we really need more, joint advocacy and investment in this area to improve communication and internet. We did invest a lot in remote services. It is effective. It is just that, the communication blackout has been impacting a lot. We have to have multiple modalities ready, to cater to the needs of the survivors and make services accessible. Technical capacity referral pathways, this is something we've been investing, but we haven't been able to cover all the states yet. GBB subsector is present now in 15 states in Sudan, but we are aiming to increase our presence and also to remote localities by promoting localization. And as you can see, technical guidance is needed, and human resources also is a big challenge as well. And turnover of staff, because of the displacement, many organizations cannot retain the staff, in the new location that they establish the presence. So these are all affecting a lot, to make, organizations fully operational in terms of capacity. Next slide, please. So GBB subsector, this is going to be published very soon, but, our colleague in Nuha, who is a localization specialist and also, looking after subnational level coordination in 15 states, she conducted a women-led organization survey targeting 41 women-led organizations. So the finding really shows that 90% of the respondents, women-led organizations, indicate that because of war, they had to lay off staff, downsize the operation. Because they downsize, they have even more, access, access challenges to funding opportunities. 38% did not receive any funds, and 70% did not even have capacity to request for funds because they are busy responding and they do not have connectivity. They lost laptop, IT equipment, stuff, and everything. So, it's not just the organization's problem, but, again, I'd really like to, emphasize the importance of supporting not just funding, but their operational capacities as well to ensure that sustainability of the, investment and the contribution that women-led organizations have been making. And then lastly, inclusion decision making. So, what I was really surprised when I, joined one of the humanitarian forum and did a presentation on women-led organization. There are 3 people raised their hands asking, why are you focusing on women-led organization? So this is a forum of humanitarian actors in Sudan. So this shows really, the lack of, understanding, recognition of the importance of engaging women-led organization, not just for GBB response only, but also all, phases, spheres, areas of humanitarian response. There's a lot they can do. And this, Shaza is going to elaborate more. My last slide is the next one. Next slide, please. Yes. So I've been talking about horrific situation, but I would really like to see share my experience that I witnessed a lot of resilience and empowerment, and also support needed for enhancing resilience and empowerment of women and girls in Sudan. So on the top left, on the International Women's Day this year, in Port Sudan, we established a women-led organization task force, led by GBB subsector and member women-led organization. So this really, is a forum, to discuss how we can mainstream, how women-led organization can contribute to improve humanitarian response to make it accessible for women and girls and mitigate the GBB risks. We are going to share, the report of this event and also, the women-led organization survey, after this event. Okay, so I only have, 30 seconds. So the left side, as you can see, 2 ladies talking. Actually, these are, women, living with disabilities. So they used to be in IDP camp a couple of months ago. They were not even able to access humanitarian assistance. They were just, the lady who's speaking, has, these challenges with mobility, so she could not move because there was no assistive devices. The women on the left, she has a hearing disabilities, so she was not able to move around also. But with the support of the women-led organization, they were managed to establish their own shop in the central market of Old Halfa City. Now they what the NGO members told us is that they look totally different. So from the women living with disabilities who are staying at home, not even being able to access to humanitarian assistance, in a couple of months, their lives drastically changed. They, had their dignity back. They are empowered, they are resilient, and they really have confidence, and, also, and they really looked happy. So what I would like to really emphasize that this is really the moment and the turning point that we really have to work together to change, women and girls' lives, and we can do it. We know what the problems are. We know where to invest. So I hope this forum will be the beginning of, further, continuing our discussion, how we can together make difference for women and girls in Sudan. Thank you so much.
Thank you so much, Akiko. And I think this is a really great segue to Shaza Ahmed from NADA. So directly over to you, Shaza. And just to let everyone know, Shaza might have to step out about 5 minutes early. She's getting her visa so she can go actually to the pledge meeting. So if you have questions for her, we'll address those first after her presentation, but please do put your questions in the chat. Thank you.
Thank you very much. Good morning, good afternoon, everybody. And my name is Shazan Najmuddin Ahmed. I'm the executive director for one of the national women-led organization in Sudan. And excuse me, as I'm in the car on my way to the French consulate. I was offered a chance to get like an appointment for my visa. So I might be in the move a little bit earlier. First of all, thank you very much for the opportunity. And during the course of the coming minutes, I will explain how NADA, our organization, addressing GBV in its programming and how our teams reconcile a GBV focus, often snowed under by other priorities such as food security, health, shelter, with the humanitarian core business to keep people alive. How we reconcile increasing demand for quality programming while decreasing fund, or simply how we can do more with less. We will navigate together on the main challenges as well as a way forward to achieve our ultimate goal, which is ending GBV in Sudan. Next slide, please. Next slide. Next slide, please. Okay, my colleague Akiko already gave a comprehensive explanation on the GBV situation in Sudan, but I'd like to highlight the new pattern of GBV in my country. We start to have like alarming reports which indicate number of children and persons with disabilities among the sexual GBV survivor. Most importantly, as the war exceeds its 9 months, and I think Akiko already touched base on that, we have number of children who were born as a result of unwanted pregnancy, simply because their mother failed to obtain a court degree, which is mandatory for abortion for a pregnant result from rape. Those children cannot be registered. They can't obtain national identification number, but more importantly, they will face access to basic needs such as vaccine, health services, and in the near future, access to education and other social services. So we are talking about a recent war with the future impact. Next slide, please. Really, during when the war erupted in Sudan and during that very tough period, many people have to be evacuated and to leave the country or to leave the conflict areas. And at that time, we have limited number of frontline respondents. So we had like local NGOs, women-led organization. We have as well like women and youth group, community protection networks, and I think there was amazing job done by community protection networks, and it was one of the best lessons learned for all of us as humanitarian actor in Sudan, that Sudan context really need to be based on community-based approaches and participatory approaches. We had also limited number of government officials because in in many of states, government officials were not present and they left the location for different reasons. And we were together there with also a number of international organizations. Next, please. As women-led organization, we found ourselves in a disastrous situation with the progress to get funded and limited available resources. We found ourselves in the middle of a situation where we really require to be creative, not only to make change, but also to aim for success. We are all affected by the war, and we were shocked by different levels. But 2 weeks after the war erupted in April 15th, with the technical support from the GBV subsector, UNFPA colleagues, and other UN agencies, we operationalized the referral pathway, and we start to provide services. For us as Nadal Azhar, the first thing we thought about and we immediately jumped to was reprogramming all our ongoing projects to accommodate GBV and to ensure that we have GBV consistently in all our operations. And we did that through different modalities. So sometimes physically by our teams being present in a specific location, while in other time we are doing remote services such as provision of counseling and case management referral services through phone calls. And of course, that required donor flexibility, which we were lucky to have. It was a limited one, but we were lucky to have timely through different country pool funding, such as Sudan Humanitarian Fund and Rapid Response Funds. Next, please. And then we jumped to operation, and we felt like as a women-led organization also, we declared that there is a big need for collaboration, not competition. We need to deliver our services using multi-sectorial response with our humanitarian actors, especially women-led organization. And we did that through different modalities, starting from distribution of cash, provision of specialized case, GBV services, including case management, clinical management of rape, referral services, provision of psychosocial support to the survivor, their families, and their communities. And I will really want to focus here on the importance of having inclusive GBV operations. So we're not forgetting the communities, because sometimes even the family members, they are, they in some cases they make a risk for the survivor themselves. And despite the limited capacity of a service provider in some locations, and also the limited capacity of the communities with regard to GBV, my colleague Kiko, she already mentioned about the different contexts in Sudan, like Northern State and River Nile. Those communities are very conservative, and those states didn't come across war or conflict or any humanitarian context before. They didn't face any displacement for any reason. So they really didn't know anything about GBV in emergency, child protection, job protection issues. So they need a lot of awareness raising and capacity enhancement to ensure that we are not harming anybody in the community while we are operating as GBV actor. So on the other hand, prevention was also a core of our work. So capacity building for GBV and non-GBV actor, raising the awareness of local community service provider as well as government official was timely delivered. And I will share like one of our outstanding achievement, despite the limited access to legal services and limited access to services at all. I mean, we have some of our SGBV survivors saw their perpetrators just judged with 20-year prison sentence, despite the limited legal services. And this is not only contribute to justice, but also to prevention. To be honest, that gave us the hope. And in the middle of the looming situation, we felt that as women-led organization, we have to be stronger. We have to stand for the rights of women and children of Sudan, and we have to do more. Following that, on January 15th, NADA, among other advocates, launched a national campaign which called for ending rape and sexual exploitation in Sudan. I mean, many times we kept our donor accountable and we asked for funding, but we felt at this time we need also to be accountable and to take some of the responsibilities for our communities. And luckily enough, 2 months later, which is like 2 weeks ago, the Attorney General gave announcement which vacate the legislation of geographical restriction. And that means victims can sue their case in any area rather than the one where the rape occurred. And this gave a better access to legal services and protection services as a very, this is a big success for all of us as Sudanese women, as a women-led organization. Next, please. That was not easy, and we faced many challenges in the implementation, and the challenges are not all on all aspects. It's not always money. So we were faced by other challenges, and I can mention some, like the mental health and psychological well-being of the survivor themselves, the mental health and psychological well-being of the communities themselves, the limited technical capacity, as I said, in the communities where we need to operate to ensure that we are not harming anyone, and we will try really to be very, very creative and to reach all people in need. We face like some obstacles for progress, but at the same time as political issues like suspension some of our operations, and one of the major challenges barrier was the safety our female staff. And as women-led organization, 92% of the staff are women, and as Akiko said, they are ready to do whatever they can, and they put sometimes their life at risk. But we really need to mitigate the risk of any risk that our female colleagues may face. As well as one of the barriers was the absence of functioning legal system in some location, and access to funds always is an issue. Next, please. I mean, with the generous support from donors, high dedication of our teams, collaboration of targeted communities, still we're left with hundreds of women and children. They are forced to marry with their perpetrators of sexual violence, and I think this is something very, very, very sad. We have hundreds of women and children living with unwanted pregnancy. We have hundreds of women and children facing sexual transmitted disease, which are dangerous and really threatening their life. And hundreds of girls, they got circumcised and they got FGM. As Akiko mentioned, it's like it's a belief or wrong negative coping mechanism that they think that FGM could really reduce the risk of getting pregnant as a result of rape. And I think this is an area where awareness raising is a life-saving. So we really need to aware those communities about the risk of FGM and to ensure that we will eliminate it as much as we can. Next, please. We cannot do alone, and I mean, like we always need to work in a more collective effort, a collective way, and we need to have like collective efforts. So we need joint efforts to facilitate access and advocate. I'm sorry for the noise. I'm really in a public place, and I'm sorry for that. So we really need to have joint efforts to facilitate access, and we need to advocate for a continued, smooth, and safe access, in particular to hard-to-reach areas. And I will call this like operational access, while we're looking also for a strategic access, which include women rights organizations and women-led organizations in negotiation around access, especially those who are really stand at front line and they are present in hard-to-reach areas. The complicated nature of the crisis underscored the need of cross-border collaboration. As we all know, Sudan is neighboring many countries and at the same time hosts big number of refugees. So we really need to ensure that our response will have like equal access to all people. We all know that, for instance, for Nadal Azhar in White Nile, our operation is really designed for refugee, South Sudanese refugees, while in Northern Darfur, it's really designed for IDPs. But I think we really need to have like a more comprehensive, dignified GBV survivor. I cannot send a GBV operation. I cannot send a GBV survivor away because it's me or my donor. They don't have, they work with the envelope of refugee in such place, and they work with the envelope of or the portfolio of IDPs in the other one. And I think that's also put all of us at risk of really losing the trust and the confidence of the target communities with whom we should serve like a quality of services. Continue high-level advocacy on GBV inclusive is crucial, and continue. And I think advocacy also is part of accountability, and we are all accountable for GBV survivor and targeted communities. Collective efforts to push for ways to get flexible funding more directly to women-led organizations, as stated by Akiko, continue to be a need. And I would request donors to build on success and really to learn from each other. We need to scale up of budget targeting GBV prevention, response, equitable access by local and women-led NGOs to quality funding as directly as possible, as directly and quickly as possible, including those pool funding mechanism. NADA is representing the national NGOs within the SHF advisory board, but really we dream to represent women-led organization in such a big forum and strategic forum in the country. The more we engage women-led organization at decision-making level, the better will be the response. And here I will call for a donor flexibility. I mean, we cannot hinder the access of women-led organization for funding because, for instance, they didn't submit a timely report because the internet connection is not well, and they don't have HQ in any other country, and all Sudan is out of connectivity, or we cannot stop procuring of life-saving CMR kits because the cost is slightly increasing, and it's not like what we proposed 6 months ago in the budget which we submitted to donor. So we really need to be flexible to ensure that we are conducting timely life-saving operation. Next, please. I mean, from here, we will fly to France, to Paris, and I think that is the ultimate goal and of all of us. We really, as Sudanese people, we look to that conference as a rescue for the people of Sudan, and we have many dreams linked to that conference, and hopefully everything will come positive. And first thing, we really need to put GBV in focus, and I will urge that GBV response should be considered central and vital to all response efforts by the entire humanitarian national and international communities. Really, it's not just the softish protection lingo that we are getting used to. I mean it, really, it's a life-saving and it's a prevention the wars. We need the support for combating all forms of GBV, early marriage, child marriage, forced marriage, as well as FGM, conflict-related sexual violence, and so on. And we need to have like a response which is holistic and survivor-centered. So we really need at a point or another to downsize the priorities that we feel like it's a priority, and we need to have everything to be need-based. Together, we need to advocate for uninterrupted access to ensure that access to hard-to-reach areas increase importance in ensuring uninterrupted cross-border response, which require also a national, advocacy at international level. And we need to have inter and intra-agency effort to peer to the complex crisis. I mean, Sudan response must reach across refugees and IDPs with the support also going to the host community, who have supported both IDPs and refugees for nearly a year without sufficient support, leading to increased stress and risk for the displaced and host communities. We also need to build our operation more strongly to include a GBV in a broader context of protection. And I mean, we know protection and GBV in particular are least defunded services across the humanitarian system. That is play a crucial role not only on life-saving services provision, but also risk mitigation and enhancing women and girls' access to services provided by other sectors. I mean, I'm encouraging donors to really invest more on women-led organization in their programming through making, like, starting from requesting for a proposal and requiring intersectoral approach to humanitarian assistance, which link protection with other efforts. We really request donors to bridge through mechanism that explicitly allow for women to support the flow of local and women-led organization and to make it easier and directly. I mean, donors should look at creative and innovation ways to ensure that funds is going directly with the flexibility that I mentioned before. Donors should invest on the capacity that we already found. And according to the women-led organization survey conducted by GBV subsector in Sudan, 90% of women-led organizations are facing a budget drop, and their operation capacity is really going down. In order to ensure sustainability of investment made before, we really want to support them technically and financially. And last but not least, as a Sudanese woman, I will say, according to the culture, social dynamic, GBV might hinder any peace talk in center location because it will fuel civil war, even if the current war is over. I encourage donors to give a chance for Sudanese women and girls through women-led organization to have a role in humanitarian work and enhance a better role in peacemaking and peace building. As women-led organization, we came from a similar communities to our target groups. So easily we can establish and work through a community-based programming during which our teams could strengthen the local capacity resilience through awareness raising and capacity building program. Through community-based and participatory approach, the need and concern of women and girls are taken into consideration from early phases of the project. I would like to take the pause on considering that GBV survivors are often hidden in society. They are stigmatized. They are facing a lot. A deep understanding of a local society with its culture, dynamic and social norm, and awareness and knowledge of these challenges is essential. Clearly, I will advocate to strong consider national actors and women-led as a potentially the best champion for GBV response. I will request that you go back to your respectful offices and governments with the story of a 13-year-old girl who is internally displaced and who is a disabled child who is currently pregnant and HIV carrier. And she's only 13 years old. And we cannot help her simply because we don't have access to funds. I will urge all of you to help women and girls in my country. Women and children in Sudan are 2/3 of the population. And I'm sure with collective and well-coordinated efforts, and with your present technical and financial support, our dream will come through, and we will end GBV in Sudan. Thank you, over.
Thank you so much for both of those presentations. I think they've been very informative. And Nada, I have mentioned that we need to go to you first for responding to questions since you might have to leave. And we have a couple of questions that have come up in the chat, and I'm going to actually ask Ana Palau if you would like to open your microphone and ask your questions yourself. And then Nada, maybe you can respond first, and then Akiko can follow. And can you actually, when you ask the question, introduce yourself so that people know which agency you're representing or which mission or organization? Yeah, over to you, Anna.
Hi, Jennifer. How are you? Thanks a lot for giving me the floor. And thanks to Akiko and Nada for this wonderful presentation. It's very informative, like you said, very interesting. So my name is Ana Palau, and I work for ECHO. I'm a TA for Sudan. So my questions are in the chat. One of the questions was about men and how, well, we know that they're obviously because of their prominent role in society, in certain societies, their voice is very much listened to. And so my question would be how in the current context and GVB programming, they are involved as agents of change. I'd be interested in hearing about that because, some programs in some contexts worked through the imam, for example, or, just religious leaders in general. And they have a big impact when messages come from men in certain contexts. So I think I rarely hear about that in GBB programming, and so I'd like to, just hear your opinion and see if there's any lessons learned in that regard, if there's something that has been done and how, if it worked. That would be one question, and for now, I'll leave it at that.
So Shaza, do you want to start and then we can go to Akiko?
Yeah, sure. I think that's why I thank you very much, Anna, for the question. It's very relevant and valid. I mean, it could be solved. I'll not it will be solved easily, but it required to understand the mentality of Sudanese men. That's why I'm saying like local NGOs. Better, I mean, they will better know how to things are functioning. So for instance, for Nadal Azhar, the early engagement of men and boys in all our programming is a key issue. If we go across all community-based protection network that established during the previous 10 years, all of them, they contain, or they are composed of women and men, not equally, but there is a composition of women and men and youth specifically. And to be honest, we invest more on youth and on young men, whom really they can make a transformation and to make the social transformation and change in the community. So the more we understand the context and the Sudanese men mentality and behavior, we designed the operation. To be honest, in Sudan, this is not something easy. For instance, the GBV response that we developed for the northern part of Sudan is completely different from the one of White Nile, where it's completely different from the other one in Khartoum. So urban versus rural areas.
Sure.
So it's really need to make like a comprehensive preparation for the response before we start with the response. In short, I can say it's important to understand the mentality of Sudanese men, to deal with them in a, if I may say, in a diplomatic way, but also early engagement was also a key factor of success for all our operation, and investing more on youth and young men is another factor for success. And I will leave it to Akiko if she want to add. I just want to add to say that all our awareness raising program, also including boys, girls, women, and men, again, not equally, but they are there and they're actively participating. And the more we start with them from the beginning, the more they're engaged in the operation. Over. I hope
For sure. Yeah, thank you, Shaza. Absolutely. I mean, they need to be active and not passive members of, agents. That's why I said agents of change, right? But we're talking about a long-term process and a change in mentality and culture. So this is not something that one can flip from, one day to another, obviously. So, but thanks a lot for your response.
Thank you, Anna, for your question. Akiko, I don't know if you want to add anything, and then we'll go over to Leo Thomas.
Sure. Yeah. I'll be just really quick, So yeah, thank you so much. So, I would like to mention two things. One is, GBV community-based protection network. They are consisting of both women and men, and men are equally engaged in GBV awareness raising, campaigns and the community activities. So, this is really a mechanism that, we encourage, local buy-in and also male engagement. Another thing is that, we have, donors, who are joining here, but, in Sudan, we have a joint FGM program, implemented, together with UNFPA together with UNICEF and WHO. So it has a long history. There's a lot of things that has built, in the past decades. I would like to express our sincere appreciation to FCDO and Canada in particular for funding this program. So we are, in discussion with, collaborating agencies. UNFPA is in discussion with collaborating agency, and also GBV success sector is supporting, to further, utilize this mechanism, this social, norms program, to address the root causes. This program is still ongoing, though it has been reprogrammed a bit, due to the context. But I think this could really contribute to the, address the root causes, particularly in the states that they have a very conservative but hosting a lot of IDP population. Thank you.
Thank you, Akiko. Thanks for your contribution, your answer.
Great. So I'm going to turn over to Leo Thomas, if you can introduce yourself and ask your question.
Thank you. I hope you can hear me.
Yep, we can hear you fine.
Yeah, thank you. And thanks, Shaza and Akiko. As you know, FCDO has been supporting a work around social norms change, and since the outbreak of conflict, we've given discretion to that program to push much more into the GBV space, and we provided an extra 4.95 million for that to happen. My question is, what's the problem in or issues in other clusters embedding a GBV responsive approach in the work that they're doing? To what degree are they reaching out to women-led organizations, or are they visible to women-led organizations? And I guess my follow-up question is, in terms of Paris, is what are the key messages around the consideration of GBV that we want to leverage into that space in Paris? Over.
Akiko, do you want to respond to this one since it's about work with other clusters? You might be doing
Sure.
more of that as a
Sure.
coordinator.
Yes, so GBB subsector, with the collaboration, with the support of, global and regional GBB AOR, we've been conducting quite a lot of GBB risk mitigation training, both at field level and national level. They all seem to be very excited to incorporate GBB, risk mitigation in their programming. However, what I see is a problem, if they do not engage women-led organization in planning process, implementation process, evaluation, assessment, all the phases, the root cause of the problem will not go, because it is not just the tips that, we can give to these organizations, WASH actors, health sector, be it nutrition or FSL, they might, think that this is one fits all approach, but it is not. It is really, needs to be contextualized. The only way to contextualize it is to engage women and girls, women and women-led organization in all phases of their, humanitarian response process. So what I, mentioned in my presentation is that, there is really a lack of understanding that how important it is and what, the difference they can make just by engaging women and women-led organization. There will be a big difference made in terms of, safeguarding and risk mitigation, but there is a, lack of, understanding. So now what we are doing as a GBB subsector, we are establishing a coalition of women-led organization. This is not really limited to GBB, so they are women-led organization working on GBB risk mitigation. They are willing to work with other sectors. So we will, approach to other sectors, propose them, they can start even in one state, that, how they can make difference by engaging actually women in their, planning and also in decision-making processes. So this is what I would really like to highlight as a big gap in Sudan. I don't know if we know Shaza has anything to add, from the, women-led organization perspective.
Shaza has excused herself, but I will just quickly add something, which is
Sure.
I think one role that donors can have is advocating for women-led organizations not to be only working in GBV and gender issues. I think women-led organization, as was just mentioned by Akiko, can contribute quite a bit to WASH, shelter, all these other clusters and sectors with their insights, and they should definitely take part in the planning as well as not just be part of a focus group at the beginning, but actually really support all the way through. And they can, with the GBV AOR, we've really been encouraging co-coordination by women-led organizations, and we think that should also be happening in other sectors. It shouldn't just be local actors, but specifically women-led organizations have quite a bit to contribute. There was a question, Akiko, on
sorry,
yeah.
Jennifer, can I
Go
just
ahead.
add something? For the recommendation, I mentioned it in the recommendation for Paris, conference as well. We would really like to, recommend donors to include it, mandatory, for all projects, not just GBB project, to mandatory to engage women-led organization, and also, include GBB risk mitigation component. This is really not the costly intervention. It does not cost a lot, but it will do contribute a lot to mitigate risks, which is extremely high in this context. So these are the 2 points that we really like to advocate for donors to consider when they are designing the funding mechanism. Thank you.
So Akiko, now that Chaz is gone, so you'll get to answer all the questions. There's a question on if you could break down a bit why FGM, what's your perception of why FGM is increasing in the current conflict situation?
Sure. I mean, as I mentioned, FGM is, increasing, because, of the increased, conservatism, in the community, and also, promoting it as negative coping mechanism. As I mentioned in my presentation, it is primarily, promoted as a, prevention of sexual violence, which is, totally a wrong concept. But this has been promoted in the community, and also, this is also in relation to child marriage as well. If they perform FGM on girls, then it's likely that they can get married as soon as possible. So in conjunction with child marriage, this has been increasing. Another thing is that because they want to conceal the fact that they have been have experienced sexual violence. Some people trying to conceal it by, having, voluntary, or like, by recommendation by the health practitioners in some cases, and, to do, FGM. So, it is primarily as negative coping mechanism. This is not, something that happened recently, but we have been observing, and increasingly, the increase in the past 6 months, at least. Thank you.
Yeah, and just to say, FGM is something that Sudan, they've been working on for a long time to reduce. There's actually been a collaboration between WHO, UNFPA, and UNICEF for like the last 15 years, supporting women's organizations. It has been women-led, to reduce, to actually eliminate FGM. And so this is really a step backwards. And because in the urban areas, there really has been in the past a reduction. So to see it increasing is quite alarming. Sudan is not with the same level of FGM that a country like Somalia has, for example. So it's very disappointing to see that there's a new trend of increasing. There's a hand raised by, and I'm afraid I might not pronounce your name correctly, Shriskun. If you can introduce yourself and then ask your question.
Thank you very much, Jennifer, and hi, Akiko and colleagues. My name is Sisakun, but everyone call me in Sudan Tuki. I'm a Sudan Protection Cluster or Sector Coordinator. I would like to compliment Akiko a bit on the GBV risk mitigation. I think there's quite a lot of things in terms of mainstreaming protection principles into the Sudan response. But at the same time, I think with the basically hunger type of prevention, the plan that is coming up in Sudan, at least I think we, together with the AORs, we spearhead to put ourselves in the benchmark. We definitely already put ourselves in terms of benchmark. The cluster, the other cluster that responds on this famine prevention or hunger prevention plan, we need to really basically do the training on the protection mainstreaming, which includes child protection, GBV, as well on this, as well as come up with type of what are the risk mitigation or risk reduction that we can do together. To also ensure that we put the centrality of protection at the core of the discussion. We also indicating that there has to be a protection focused type of discussion. And I think that for us, we were working very much with the community-based structure. We also can be a very mouthpiece and also helping the other cluster who are responsible on this. So I think with this upcoming plan, although we know that, the life-saving or not as a like protection in general, whether it's a life-saving services or not, is very much debatable in Sudan. But I think there is an opportunity for us to show that how we be relevant on this. So, this is something that together with Akiko and the other colleagues, this is something we can do together, at least from Sudan part. Thank you very much.
Thank you, Tiki. And yes, I think there's great collaboration within the protection cluster. So thank you for sharing. We're almost out of time, and there is one more question, which creates a great segue. It's coming from Fiona Quinn, who is asking if funding for donors who want to fund organizations like NADA, I won't say only NADA, women-led organizations, can the funding go through UNFPA or UNICEF, which is a great segue. And I have been in a number of women-led organization discussions, including I recently went to the Wilton Park meeting that FCDO organized. And I was accompanied by Nuha, who's the one that did the survey on women-led organizations from Sudan, so that she could also provide her insights on this. And I'm going to turn over. I'm glad you turned on your screen, Fiona, since the question came from you. So please go ahead and formulate your question yourself. But
yeah, no,
it's a great
I think
segue.
you got it. Yeah, I just wanted to really know. I work with Irish Aid, and we're very committed to addressing GBV in humanitarian context, and we have already made sure that funding is available for GBV in Sudan with are a partner, an NGO, international NGO partner. But I'm just wondering if we were to try and make a concerted effort to fund local women's organizations in the country, how could we go about that? We fund the Sudan Humanitarian Fund, and we've been very pleased that the Humanitarian Fund has steered funding to the emergency response rooms and to some of the grassroots entities that are so vital in Sudan. But I'm just wondering,
Yeah,
from
that's
their
great.
perspective, what did
And-
it's easy to say, okay, we want direct funding, but it's very, very difficult from headquarters that
Yes.
don't have presence in the country. How do we do it? Thanks.
Yeah, and I would just like to add the caveat to that I think many of us from UN agencies, INGOs, other kinds of donors are looking exactly at how can we make this happen. I'm very happy that Reem, who is from BHA, put into the chat that BHA is directly funding NADA. So that's somebody you could reach out to if you want to talk to another donor, and also through the Women, Peace and Security Fund. But I'm going to turn back to Akiko because I know UNFPA has been working hard at also looking at what are the different mechanisms that can be used through UNFPA as well as directly. And I would say the first thing that women-led organizations will really emphasize is they prefer to be funded directly than to go through an intermediary. We know it's not always possible, but that's the first choice, which is why it's so exciting to see that BHA is funding directly, because they're one of the ones who a couple of years ago said, no, it's not possible, and they made it happen. Also, just to say, within the call to action, we're also really trying to look at how to make this possible. IOM, for example, has been running a fund for about 8 or 9 years in South Sudan, where they're giving funding directly to local organizations, including women-led, and that's the fund, I believe, is happening through the Women, Peace and Security Fund. That's in Sudan. I think that's also with support from the US and using IOM as the intermediary. But I'm going to let Akiko speak first, and then Reem, if you want to add something after Akiko, and then we'll be closing. So over to you, Akiko, and then to Reem.
Sure. Yeah. Before I start, I'd like to, announce that, we are selecting one women-led organization to co-lead, GBV AOR coordination in Sudan, which will be, the organization will be announced soon. We did the, call for nomination. We finalized our selection. I think will officially be announced very soon. So, we would like to make it more, women-led organization friendly and empowering environment. Now, having said this, we've been advocate for, for SHF funding to include more women-led organization, but they have, they need to go through assessment and their criteria. So what we've been doing is that we are in contact with, NADA is relatively a big and women-led organization with very strong capacity, which is able to receive funding directly from donors. But they are 90% of the women-led organization are medium or small scale, or even dropping off to community-based. They don't have capacity. So what a UNFPA, for taking the example of UNFPA, they are trying to establish a small-scale funding combined with a capacity building program. Investing, just like I mentioned in my presentation, operational capacity, is extremely weak, and they lost their stuff. So investing in their operational capacity, provide coaching and guidance, setting up their operational capacity is extremely important to make our investment sustainable. So we are, the UNFPA is establishing this, small scale funding mechanism. I know that UNCR, UNICEF, IOM, UN Women, they are all setting up a similar mechanism. I'm not really sure about capacity building, but at least small scale funding with some coaching to enhance operational capacity. And I know that some international NGOs have localization scheme, which includes, women-led organization. Another thing what we do is that we have a list of women-led organizations that are operational, in 15 states we are covering. We are in close contact with them. We know their capacity. So when a new, project is, starting in certain states, we try to link them up with women-led organizations so they can work, as a, subcontractor. I know that they really would like to be, independent and, receive direct funding. But if it is not possible, at least they can receive, funding through international NGOs or bigger NGOs that are operational in that area. So, with combining all these efforts, I really hope that they will, develop their operational capacities. Now, they're responding to 49% of the overall response. Now, their, importance is increasingly important, and also they are really in the hard to reach areas. So to make it really sustainable, this is really, we've been doing it, for several years, but this is really the year to, invest more on women-led organizations, not only on funding, but capacity. Thank you so much.
I don't know if Reem is still online, if she wanted to say anything about the US, but she is with BHA. Yeah, you're there. Reem, do you want to say something?
Yeah, thanks, Jen. I know we're over time, but maybe just to say a couple of words. It's work in progress. We started by funding women-led organizations under international organization partners such as UNFPA and IOM. But then also we started looking into mechanisms for funding the WPHF under a sort of like global grant that we run, but then could also have earmarked funding for specific countries, and now making a contribution for Sudan. And with a lot of effort from our teams on the ground, we're now moving to funding one women-led organization directly, which is going to be our first national NGO. So that's quite exciting, but it did take a lot of effort and years into the making, but happy to speak one-on-one, Fiona, to share more about how we got to where we are now. Thanks, over.
So this will be the last question, and I realize we're 6 minutes over, so if you need to jump off, we completely understand. You're not going to be offending anyone. So Nev, do you want to introduce yourself and ask the last question?
Yes, thank you so much, and thank you, Akiko, for a very impressive but somewhat depressing presentation. I only have one question, and it's not for this meeting, but perhaps you could follow up the meeting with an email analysis of your funding coverage compared with other sectors, because we know that this sector is particularly underfunded in an underfunded context. But it would be very helpful, I think, for donors to have that those relative comparisons with other sectors. If that would be possible, that would be very helpful. Thank you.
Thank you for that question, and we will come back to you with the analysis. And I would like to hand over to Akiko for closing words.
Thank you so much. And I know that, it's right after Easter holiday, and I know that there are several other important meetings ongoing, but thank you so much for joining us. And, we will be sharing with you the recommendations we developed jointly as a team. Hope it will be really helpful to prepare for the Paris, conference. If you have any questions, please let us know. There's an email, and also there's email in my presentation, which Helena will be sharing, after the presentation, after this, meeting. Just like I said, we, together we really can make a difference. If you look at this, women living with disability, how their lives, drastically changed in a couple of months. I want this to happen, to all women and girls in Sudan. And together, I believe that we can make a difference, So we hope to look forward, we look forward to working together with you. And thank you again for joining this meeting.
And do please feel free, as Akiko said, to reach out. You can reach out to the contacts that are in the documents that will be shared, but also please do share the information with your colleagues. I know there was a number of people who couldn't make this, so we will also be sharing the recording. But if you have colleagues who are attending the meeting and the pledge meeting in Paris, please do send them the key recommendations. And if, we have Akiko definitely has been working with many women-led organizations. So NADA is a great example, but there are other women-led organizations that if you want to choose a specific geographic location or know more, we're happy to also provide that information and make those connections. And as we said, we know that direct funding is the ideal. We also understand it's not possible for everyone yet. So there are mechanisms, intermediaries that you can fund through. And, you know, we're hoping that all the efforts being taken, like the Wilton Park, like the call to action, are looking for different ways, and including all the agencies that are part of the AOR, looking for ways to operationalize funding that can go directly to women-led organizations working on GBV. And as Nev pointed out, we are one of the most underfunded within protection and within the whole cluster system. So any funding is greatly appreciated. And services, women and girls. So thank you all very much. And a big thanks to the Policy Advocacy Reference Group that's co-chaired between IRC and Troquer, Lena and Paul as well, sorry, and Colm, in addition to our speakers, and to Shiva, who helps us with all of the logistics. Thanks, everyone.